Hello, I'm here today to provide you, the patient, with some important information regarding your upcoming colonoscopy. By presenting you with this information, we hope to minimize any potential discomfort and prepare you for a fast and successful procedure. We understand that preparing for a colonoscopy can be an inconvenience, but believe me, it's worth the hassle. Proper bowel prep helps to avoid the doctor missing any polyps or lesions and reduces the chance that the procedure will have to be repeated. But before we discuss preparing for your colonoscopy, let's talk first about the colon and its various functions. The colon is part of the large bowel or large intestine, which is the final part of the body's digestive system. The large bowel has 4 parts: the cecum, colon, rectum, and anus. The colon's function is to help absorb nutrients from digested food, as well as the formation and storage of stool. Over time, the tissue of the colon may develop small growths called polyps. These polyps may be normal or benign, but sometimes they can turn into colon cancers. Which is why, depending on the patient's age, circumstances, and family history, the doctor may recommend a colonoscopy to examine his or her colon. And that brings me to my next topic. What exactly is a colonoscopy? A colonoscopy is a medical procedure that allows the doctor to look inside your colon and rectum for problems such as polyps, tumors, ulcers, inflammation, and bleeding. For the procedure to be beneficial, there are steps you'll need to take ahead of time. First, you need to cleanse your bowel completely. This cleansing process is called bowel preparation, or prep, and it is a key requirement for a successful colonoscopy. If the bowel prep isn't done properly, your doctor may not be able to clearly see your colon. As a result, polyps or other abnormalities may be missed, the colonoscopy may take longer than usual, or the colonoscopy may need to be repeated at a future date. The better the quality of your bowel prep, the higher the chance that the doctor can find polyps. And by finding polyps early, there is a better chance of preventing colon cancer. The bowel prep process includes dietary restrictions and taking a bowel prep medication. The key here is to plan ahead with your doctor. Before your colonoscopy, your doctor will give you the exact diet and bowel prep instructions you need to follow. Please make sure you read all the instructions ahead of time and plan accordingly. Also, be sure to talk to your doctor well ahead of your colonoscopy about any regularly prescribed medications you are taking, as well as any health conditions or allergies. Some medications may need to be adjusted prior to your colonoscopy, such as insulin, blood thinners, aspirin, and/or heart medications. Keep in mind that 3 days before your colonoscopy, you will need to begin a low-residue diet of foods that are very low in fiber and easy to digest. Examples of low-residue food include lean meat, chicken or fish without skin, eggs, canned fruit and cooked vegetables without skin or seeds, limited amounts of dairy, white bread, rice and pasta, and plain crackers. Here are some foods you should not eat 3 days prior to your colonoscopy: whole grains, nuts, seeds, fatty foods, tough meat, raw or dried fruit, raw or partially cooked vegetables, corn, broccoli, peas, or beans. Keep in mind that the day before and the day of your colonoscopy, you will need to limit your diet to clear liquids only. Examples of clear liquids your doctor may recommend include clear broth, black tea or coffee, clear light-colored juices, clear soft drinks, clear sports drinks, plain gelatin without fruit, pulp-free juice bars, and water. Don't drink any liquids you can't see through, which include alcohol, dairy products, and red or purple liquids. These colors may linger in the colon and make the examination more difficult. When the day of the colonoscopy arrives, make sure not to drink anything 2 hours before your procedure. Okay, now that we've gone over dietary restrictions, let's talk about another key component of preparing for a colonoscopy: bowel preps. Bowel preps are prescription medications that cause diarrhea for several hours in order to empty your colon. They require that you drink large volumes of liquid and stay well hydrated during the process, which means you will need to stay near a bathroom for several hours until the effects of the prep medication have worn off. Your doctor will prescribe the bowel prep medication that is right for you based on your medical history, physical health, and personal needs. There are different types of bowel prep medications available, and your doctor will give you the exact instructions to follow. But no matter which bowel prep medication you are prescribed, the recommended way to take it is called split dose. This means you will need to drink half your bowel prep medication the night before your colonoscopy and drink the other half 4 to 6 hours before your procedure. The timing between finishing your last prep medication dose and starting the colonoscopy procedure is important because it ensures you have the cleanest colon possible for your colonoscopy. As a reminder, do not drink anything for at least 2 hours before your procedure. And side note, bowel prep medications should be used with caution in patients with heart failure, renal failure, end-stage liver disease, or other medical conditions. Be sure to talk to your doctor if you have any of these conditions. That pretty much wraps up the preparation process. Now, I know for some people, preparing for a colonoscopy may feel intimidating or uncomfortable, but the truth of the matter is, it's an important screening procedure. Not to mention the fact that the procedure itself is generally safe and complications are rare. Complete bowel prep is the key to a successful colonoscopy, and a colonoscopy is the easiest and best way to detect and prevent colon cancer. Make sure to be proactive about your bowel health by following doctor's orders. Thanks for watching, and here's wishing each and every one of you a healthy bowel.